This is an isometric open kinetic chain exercise used to strengthen the quadricep muscles. A regression for this exercise would be to remove the ankle weight.
Wall sits are a closed kinetic chain isometric exercise for knee flexion. This exercise targets the hamstring muscles along with the core. To progress this exercise, a patient can hold a squat, and to regress, they can hold onto a table with their arms.
This is an isotonic open kinetic chain knee flexion exercise called hamstring curls occurring in the sagittal plane. The patient positioning for this is lying prone on a table with one leg extended back and the other leg flexed at the knee and flexed at the hip at the side of the table. The spine is to be level. The resistance band is tied around the ankle, and while the AT holds the band back for resistance, the patient is to flex their knee against the resistance and extend back out. The AT will be holding the resistance at a downward angle, looking at the patient for any error as well. Some cues would be to keep the torso straight without rotation or hiking, keep the hips flat on the table without hiking for compensation, and keep the contralateral foot flat on the floor to aid with weight distribution. The eccentric motion would be the knee extending against the resistance, and the concentric motion would be the knee flexing against the resistance. This exercise targets the hamstrings and the glutes. The patient will perform this exercise for 2 sets of 20. A progression of this exercise is doing it for time instead of reps, so the patient could increase their speed of the hamstring curl throughout a set amount of time, such as 30 seconds. Another way would be to increase the resistance band to a higher resistance, or add a slower timed eccentric movement. A regression of this exercise would be to decrease the resistance or change the resistance band to a lighter one. This is an isotonic closed kinetic chain knee flexion exercise called split squats that is performed in a sagittal plane of motion. The patient positioning for this exercise is having their feet one in front of the other with a good width apart so that both their knees flex at a 90-degree angle. The front foot will be flat on the ground while the back foot heel rises off the ground. The patient holds the weight, keeping their back flat and their face upright, facing forward. The patient squats to the ground and back up. The AT can position themselves lateral to the patient to look for any compensations or errors and to spot if the patient loses their balance. Some cues would be to avoid excess forward flexion, push your weight through your big toe and heel of your front foot, squat directly downward to the ground, and keep your head upright looking forward. You also want to avoid touching your back knee to the floor. The eccentric motion is when the knees are flexed going down to the ground, and the concentric motion is coming back up from the ground where the knees are going into extension. This is a quad dominant exercise. However, as the knees are flexing, they are actively using the hamstrings. Other muscles that are targeted in this exercise include the glute max, the glute med, and the glute min. The patient would perform this exercise for 3 sets of 10 reps. A progression of this exercise would be to increase the weight being held, hold the eccentric phase for longer, for example, going down for a count of 4 and coming up for a count of 1, and change the surface area to an ARX pad. A regression of this exercise would be to diminish the weight. If the patient is unable to split squat correctly, they can perform single leg balance into a reverse lunge, or apply an upper extremity support for assistance, such as holding onto a table.
A functional exercise for knee extension is a squat. This targets the hamstrings, the glutes, and the quads. A regression would be to do a quarter squat or elevate the patient's heels.
Step-ups with a knee drive is a functional knee flexion exercise. This exercise targets the hamstrings along with the quads, glutes, and core. To progress this exercise, a patient can hold dumbbells in their hands or make the step higher off the ground. To regress this exercise, a patient can eliminate the knee drive or lower the step closer to the ground. A patient can perform 3 sets of 20 of this exercise, having every step count for 1 rep.
For our isotonic knee extension exercise, I have seated knee extension with a resistance band. This exercise is an open kinetic chain exercise, and it targets the quadriceps as well as the hamstring muscles. The concentric contraction occurs when you are bringing the foot up against the resistance band, and the eccentric contraction is during the phase of lowering the leg back to the ground at 90 degrees. To position your patient, have them seated with a resistance band on one ankle or foot and have them tie it around their other foot while performing knee extension. You can cue your patient to slowly contract and relax. For our isotonic knee extension, this would be a closed kinetic chain exercise, and we can call these inverted lunges or reverse lunges. Pictured in the video, you can see that there is a slider underneath my right foot, and this is used to continue that closed kinetic chain pattern. These muscles being targeted with this exercise are the glutes, the hamstrings, as well as the quad muscles. And you're also getting some stabilization with the intrinsic foot muscles. Some patient cues would be to slowly push the leg backwards and tighten the core